Hello, everyone. This is Dr. Tidman. Thank you for joining me for another part in this five-part series of how to interpret lab results from a metabolic health perspective. Today's part 4 is on HSCRP, that's C-reactive protein, and TSH, thyroid stimulating hormone. I will be sharing the lab values and what they mean from a metabolic health perspective. And then, of course, at the end, I always give you my suggestions on some health modifications you can make that may influence these lab values. Remember that this presentation is for informational or educational purposes only. Please consult your medical team if you want to make any changes. So for this part, I'm going to be talking about HS, that's high sensitivity C-reactive protein, and TSH, a thyroid marker. I'll go over the labs and lab values, their relationship to metabolic health, and then some common everyday approaches that you can put in place to address these lab values if you find a problem. So what is high sensitivity C-reactive protein? I'll bet your doctor doesn't run this one very much. The reason I like it as a metabolic health practitioner is it tells me a lot about the generalized inflammation in your body. We know that systemic inflammation can influence a lot of different bodily functions. First of all, your brain is exquisitely sensitive to whole body inflammation. So we know that high levels of HSCRP indicate a higher risk of heart disease, stroke, cancer, or even dementia. So I think it's an important marker to have tested at least every year, but you're going to hear that I would suggest you test your metabolic health markers every 6 months. This is the way that you can make adaptations and changes that you need to make and be informed about how your body is really doing. Normal ranges of HSCRP are below 3.0. I actually like to see CRP down around the 1.0 range. Moderately elevated is between 3.1 and 10, and anything over 10 milligrams per liter is very high and more likely indicating some sort of inflammatory event going on. Remember that HSCRP can be elevated for acute inflammation events like viruses, things like bronchitis, or if you have rheumatoid arthritis, which is going to cause high levels of inflammation in your body. So what is TSH? Thyroid stimulating hormone. It's one of the thyroid markers. There are a few others. If your TSH is abnormal for some reason, before everybody gets all worried, I would ask to have other thyroid values checked. I'll go over these in a minute. So, indicators of low thyroid hormone levels can cause fatigue, weight gain, thinning hair, dry skin, and depression. High levels of TSH can lead to tremors, rapid heartbeats or irregular heartbeats, and weight loss, significant weight loss. Normal ranges of TSH are typically between 0.45 and 4.5. A recent study suggests that between 0.5 and 4.12 may be a better range for some people. Now, if this TSH value is elevated or abnormal in some way, they can also test something called free T4 and 3. I can say it, free T3. These are other thyroid markers that confirm or deny that you actually have a thyroid problem. Thyroxine is another thyroid marker that can be investigated. So I would suggest not getting overly worried about an abnormal TSH, but ask your doctor to test these other thyroid markers to confirm that there's a problem. Of course, treatment for thyroid is typically medications, but there are some natural thyroid supplements that also help. Another way to influence your thyroid is to be sure that you're getting plenty of iodine in your diet. Now, interestingly enough, I just found out that all of the salt that we've used for many decades had added iodine to it. But there was a time when iodine was removed from our salt supplements. So check your salt supplement, your Morton salt or whatever it is you're using, and see if it has iodine in it or has the term iodized on the label. If it is not iodized, then I would guess that you're not getting enough iodine in your diet. There are some iodine drops and supplements that you can get, and some salt that has iodine in it. I would definitely go in that direction. What are some other ways that you can improve your HSCRP and your thyroid? Well, you can do an anti-inflammatory diet, and guess what that is? Yes, it is a ketogenic diet with some added MCT and coconut oil. Elevating your blood ketones will have an anti-inflammatory effect. Implement some fasting, especially if you're struggling with weight, and see if a 16-8, 2 meal a day, or a 20 to 23 hour fasting window with 1 meal a day really helps to improve these markers. Of course, exercise can be very anti-inflammatory. Address your microbiome. I've said these before. Adequate vitamin D intake also can help your immune system, which can lower your HSCRP or inflammatory marker. There's my salt remedy. Salt in lemon water every day. Drink a lot of water. Give your kidneys some help. They certainly need more water intake. And test your blood markers every 6 months. If your doctor will not test your HSCRP and TSH every 6 months, again, you can order these yourself. Very reasonable on some of these lab sites like Own Your Labs or Life Extensions. Here is the reference I used for the lab values in today's presentation. If you have any questions about HSCRP, TSH, or any of your lab values, email me at melanietidman@gmail.com. And remember to subscribe to my channel. This really helps me. And make some comments in the comments section if you felt like this was useful or you have a question. Hit the notification bell so you'll be apprised of the next video in this series. I upload these videos every Monday. Again, thanks for stopping by, everyone. See you in the next video.